Hi friends, good evening. Once again, welcome back to my channel Mugambika Nursing. Friends, here we are discussing questions for RRB staff nurse exam preparation. Also, these questions will helpful for your other nursing officer exam preparation. Here we are discussing previous year questions and answers. This is staff nurse exam grade 2 question paper. First 20 questions we discussed in the previous video, and from question number 21 onwards we can see from today's video. Question: the best indicator for identifying the adequacy of fluid replacement therapy in acute phase of burns. Options: option A, serum potassium level; option B, serum sodium level; option C, sunken eyes and skin turgor; option D, urine output. Here the question is, among this option, which one is the best indicator to understand or to identify the importance of fluid replacement therapy in case of acute phase of burns? It is urine output. Option D is the correct answer. After burns, generalized dehydration occurs in the body, also decreased blood volume and reduction in urine output occurs in the body. This reduction in the urine output is or decreased urine output is mainly due to fluid loss, decreased renal blood flow, and also reduced sodium and decreased water reabsorption all occurs in the body, so that there may be chance of urine output reduction. So we have to give fluid replacement therapy for the patient. Move on to the next question. A social group with we feeling and living in a given area is. Options: option A, family; option B, society; option C, race; option D, community. Question: a social group with we feeling or occurs in the community. Option D is the correct answer. Move on to the next question. The first step to be followed by a healthcare worker who sustained a needle stick injury. Options: option A, inform the supervisor immediately; option B, squeeze the area and expel the blood; option C, wash with soap and water; option D, clean with povidone and cover the area. Suppose if we got a needle stick injury while doing care to the patient, what we have to do? Okay, we have to wash with soap and water. Immediately we have to clean with soap and water. Option C is the correct answer. Move on to the next question. The method of disposal of discarded medicines and cytotoxic drugs include outdated, contaminated and discarded medicines. Options: option A, autoclaving after mutilation and shredding; option B, secured landfill after mutilation and shredding; option C, incineration without mutilation and shredding; option D, microwaving without mutilation and shredding. The best method of disposal of discarded medicines and cytotoxic drugs by secured landfill after mutilation and shredding. Okay, option B is the correct answer. And the next question, while discussing about post-exposure prophylaxis for hepatitis B infection, the correct procedure of post-exposure prophylaxis for an unvaccinated healthcare worker and the source is unknown as. Here the question is, which is the correct procedure or correct sequence of post-exposure prophylaxis for hepatitis B for a health worker? Unfortunately, he got an infection of hepatitis B and the source is unknown. So, what is the correct sequence of hepatitis B prophylaxis? We can give first dose of hepatitis B immunoglobulin and complete vaccination in 0, 1, 3 doses. Option C is the correct answer. Administer 1 dose of hepatitis B immunoglobulin and complete vaccination in 0, 1, 3 doses. Option C. And the next question is, Weil-Felix reaction is used to diagnose disease caused by. Options: option A, rickettsia; option B, mycoplasma; option C, chlamydia; option D, clostridia. Weil-Felix reaction is used to diagnose rickettsial disease. Option A is the correct answer. And the next question is, best procedure for managing upper airway obstruction in an infant is. Options: option A, Helmich maneuver; option B, 5 black slap and 5 chest thrust; option C, black slaps continuously till object expelled out; option D, abdominal compression. Here the question is, an infant got upper airway obstruction. Okay, upper airway obstruction, we can manage. The best first aid measures is give 5 black slap and 5 chest thrust. Option B is the correct answer. Move on to the next question. What should rescuer do after the automated external defibrillator delivers shock while doing BLS? Options. Option A. Immediately check the carotid pulse for no more than 10 seconds. Option B. Immediately restart CPR beginning with chest compression. Option C. Wait for the AED to analyze the rhythm. Option D. Provide to breathe to the victim. If the automated external defibrillator delivers shock while doing BLS means what the rescuer do is immediately we have to start CPR with chest compression. Okay, so here the correct answer is option B. Immediately restart CPR beginning with chest compression. Move on to the next question. Which of the following findings would the nurse expect to assess in hypercalcemia? Options. Option A. Prolonged QRS complex. Option B. Tetany. Option C. Pettike. Option D. Urinary calculation. Question. Among this option, which finding we can see in case of hypercalcemia? First one, prolonged QRS complex. Prolonged QRS complex we can see in case of hyperkalemia. So that is not a correct answer. And tetany we can see in case of hypocalcemia. And pettike is not related to hypercalcemia. So answer will come option D, urinary calculation. And the next question, a client with end-stage renal disease is admitted in nephrology ward and his blood result shows serum potassium as 6.6 milliequivalent per liter. What should the nurse assess first? Here the question is, serum potassium level of an end-stage renal disease patient is 6.6 milliequivalent per liter. Normal serum potassium level is 3.5 to 5.1 milliequivalent per liter. Here patient serum potassium level is 6.6 milliequivalent per liter. That means it is hyperkalemia. In hyperkalemia we can see there is slow, weak, irregular heart rate we can see. So we have to assess the cardiac rhythm of the patient. Option A is the correct answer. Move on to the next question. In a health education section, a nurse explained the reason for chronic cough. Expect. Options. Option A. Angiotensin converting enzyme inhibitors. Option B. Chronic smoking. Option C. Beta blockers. Option D. Chronic bronchitis. Here the question is a health education section. A nurse is giving education to the patient. So in this option, which one is not a reason for chronic cough? Okay, except is the question. So here the correct answer will come option C, beta blockers. First option, angiotensin converting enzyme inhibitors. For example, captopril, enalapril or ramipril, all some examples of angiotensin converting enzyme. The main side effect of this NCE inhibitors is nausea, vomiting, diarrhea and persistent dry cough. Dry cough is one of the side effect of angiotensin converting enzyme inhibitors. So that will not come. Then chronic smoking also cough will come. Chronic bronchitis also cough will come. But in beta blockers there is no side effect of cough. So that is the correct answer. Move on to the next question. Which of the following is not a primary prevention? Options. Option A, pulse polio immunization. Option B, vitamin A supplementation. Option C, breast self-examination for tumor. Option D, isoniazid to a baby breastfed by a sputum positive tuberculosis mother. Correct answer is option C, breast self-examination for tumor. Move on to the next question. Which is the best measures for evaluating standards of therapy? Options. Option A, specific death rate. Option B, case fatality rate. Option C, survival rate. Option D, crude death rate. Best indicator for evaluating standard of therapy is survival rate. Option C is the correct answer. Move on to the next question. The first person becoming sick in an epidemic is called. Options. Option A, index case. Option B, primary case. Option C, secondary case. Option D, none of this. The first person who is getting particular communicable disease in a community is known as primary case. Option B is the correct answer. And the next question, vaccine contraindicated in pregnancy is options. Option A rubella, option B typhoid, option C diphtheria, option D hepatitis B. Which vaccine is contraindicated in pregnancy? It is rubella. Option A is the correct answer. And the next question is, commonest agent causing diarrheal disease in infants and children is options. Option A E. coli, option B rotavirus, option C Vibrio cholerae, option D salmonella. Which is the common cause of diarrheal disease in infants and young children is by rotavirus. Option B is the correct answer. Move on to the next question. All are true about an ideal contraceptive except options. Option A safe and inexpensive, option B irreversible, option C independent of coitus, option D does not require frequent administration. And the correct answer is irreversible. Option B is the correct answer. Move on to the next question. All of the following are food fortifications except options. Option A iodization of salt, option B addition of vitamin A and D to vanaspati ghee, option C addition of color to saccharin, option D addition of iron to wheat flour. Among this, which one is not a food fortification? So correct answer is addition of color to saccharin. Color addition is not a type of food fortification. So here we are discussing previous year staff nurse exam grade 2 question paper. Remaining question we can see in the next video.